Many men experience gradual changes in their physical and mental state over time. Energy levels decline. Fat accumulates around the waist. Recovery becomes slower. Focus and motivation decrease. These changes are often explained as stress or aging. Scientific research suggests that declining testosterone levels are frequently involved. Testosterone is the primary androgen hormone in men. It is produced mainly in the testes and regulated by a hormonal system involving the brain and endocrine glands. Research shows that testosterone plays an essential role in muscle mass maintenance, fat metabolism, bone density, red blood cell production, cognitive performance, mood regulation, and sexual health. When testosterone remains within a healthy physiological range, the body maintains metabolic balance and physical resilience. Population studies show that average testosterone levels in men have been gradually declining over the past several decades. This decline remains evident even after adjusting for age. Men today often have lower testosterone levels than men of the same age in previous generations, indicating that lifestyle and environmental factors play a significant role. Low testosterone, clinically referred to as hypogonadism, typically develops gradually. Symptoms do not appear suddenly. Because the onset is slow, many men adapt without recognizing the presence of a hormonal imbalance. The body compensates until functional limits are reached. Research associates low testosterone with persistent fatigue, reduced muscle mass, increased visceral fat, decreased libido, impaired concentration, and changes in mood or emotional stability. Some studies also link low testosterone to reduced stress tolerance, slower recovery from physical activity, and decreased overall quality of life. These symptoms are often nonspecific, contributing to underrecognition. Sleep is a critical regulator of testosterone production. Testosterone follows a circadian rhythm, with peak secretion occurring during deep sleep stages. Repeated sleep restriction has been shown to significantly reduce testosterone levels, even in young and otherwise healthy men. Chronic psychological stress further contributes to hormonal disruption. Elevated cortisol levels suppress hormonal signals responsible for testosterone synthesis. From a physiological perspective, prolonged stress shifts the body toward survival mechanisms, reducing anabolic and reproductive function. Nutrition strongly influences hormonal balance. Diets high in refined carbohydrates, added sugars, and ultra-processed foods are associated with increased inflammation and insulin resistance. Excess visceral fat increases aromatase activity, converting testosterone into estrogen. Research also indicates that inadequate intake of protein, healthy fats, zinc, and magnesium may impair testosterone production. Physical activity patterns are closely linked to testosterone regulation. Resistance training and mechanical muscle loading stimulate androgen receptor signaling and support testosterone synthesis. In contrast, prolonged sedentary behavior is associated with metabolic and hormonal decline. Environmental exposure to endocrine-disrupting chemicals has been increasingly documented in scientific literature. Compounds found in plastics, pesticides, and industrial materials may interfere with hormone synthesis, metabolism, and receptor sensitivity. These effects are often cumulative and develop over time. Testosterone-related changes do not automatically require pharmacological intervention. Clinical guidelines emphasize lifestyle modification as a foundational component of hormonal health. Without addressing sleep quality, stress load, nutrition, and physical activity, medical interventions alone provide limited long-term benefit. Evidence-based strategies that support healthy testosterone levels include consistent sleep duration, structured resistance training, balanced nutrition with sufficient protein and fat intake, reduction of visceral fat, and effective stress management. Adequate vitamin D status and regular exposure to natural light also support hormonal regulation. Low testosterone is not a reflection of weakness or personal failure. It is a physiological condition influenced by multiple modifiable factors. Early recognition allows for preventive action and may reduce the risk of long-term complications such as metabolic dysfunction, decreased bone density, and cardiovascular disease. The body communicates through measurable signals. Fatigue, changes in body composition, and cognitive decline reflect underlying biological processes rather than random variation. Understanding testosterone through scientific evidence allows informed and rational decisions. Modern life presents challenges to male hormonal health, but awareness creates opportunity. When contributing factors are addressed, physiological balance can often be improved. Testosterone is not defined by age alone. It is defined by regulation, function, and lifestyle context. Supporting that balance is a central component of long-term male health.